Hello everyone, I'm doing my week 2 discussion on behavioral health questions. And I've got kind of a set of questions that I ask every applicant that come in. There's about 6 or 7 kind of that I have a base on, so I'll start and I'll read all 6 of those to you. So my first question that I always ask is, what are you looking for in a new position? And then I move on to, and I always ask, what would your former or current manager say your strengths and or opportunities for improvement are? And then I get into a little bit more of the behavioral health questions. Tell me about a time when you went above and beyond to get a job done. And what projects have you started on your own, and what prompted you to get them started? And the next question is, tell me about a situation you wish you had handled differently based on the outcome. What would you change if faced with a similar situation? Describe a situation that requires you to do a number of things at the same time. How did you decide what to do first? And how do you determine what priorities when scheduling your time? And since I'm over the emergency room, this is really important because we do have to multitask, so it's kind of good to see kind of what priorities that they have set for themselves. The next one is describe a situation in which you had to handle a difficult or demanding patient and or customer. And once again, working in the emergency room, we get a lot of stressful situations, stressful family members. You know, everybody thinks that their emergency is a true emergency. So we do get a lot of difficult patients. So it's always kind of nice to see how they handle difficult patients. And, you know, I'm really looking to make sure that they stop and they listen to what the patient or the family members have to say and then answer appropriately after that. The next one I use is, please give me your best example of working cooperatively with a team to accomplish an important goal. And, you know, once again, the emergency room, we try to multitask and work together. And when a certain patient comes in, like a chest pain, it's a team effort that I try to get, you know, 3 or 4 nurses in the room at the same time to get the key elements done. And then, you know, then the primary nurse can obviously take over. So teamwork is very important in the ER. Those are the questions that I ask every applicant that come in, and then I also have kind of a list of other questions that are more specific to the certain departments that I am over.